According to the American Medical Association, only 5% of American doctors are Black. Only 2% are Black men. And that lack of diversity directly impacts the quality of health care in communities of color. Now, a group of Black doctors is determined to change that. They've made it their mission to see more Black men in white coats.
We need more Black men in white coats because we need to save the lives of more Black men, period.
There were fewer Black men applying to medical school in 2014 than in 1978.
There are several medical schools that do not have any Black men in their classrooms. When that is the case, and we're in a learning environment, there's going to be different conclusions made about how to care for people if there are not diverse people around the table.
Really, really powerful. Joining me now are two doctors trying to change this narrative. Dr. Jedan Phillips is a family medicine physician and clinical associate professor of medicine, and Dr. Wilfred Farquharson is director of a child and adolescent psychiatry outpatient clinic. Both are with Stony Brook Medicine. They recently screened the Black Men in White Coats documentary with local high school students. Welcome to you both. This is such an important discussion. Now, it's not just a documentary, it's part of a national movement. How did Stony Brook Medicine get involved?
Yeah, so we were approached or received email communication from the American Medical Association that they were hosting screenings of the film. And so we submitted an application and we were selected due to our pipeline programs that already exist at Stony Brook, and us recognizing the need to diversify the healthcare industry. And so we were selected to put together an event, and all we had to do was present the film to a variety of audiences and then host panel discussions, particularly with Black men in white coats that could speak to their experiences.
Yeah, and Dr. Phillips, why is this documentary necessary, and what specifically stood out to you?
Well, good morning, and again, thank you for the opportunity. I think what stood out to me in the documentary was the importance of encouragement. You know, I was very, very fortunate to have parents and a community where I grew up in Queens, New York, that were very encouraging of me and my academic talents. And I think that encouragement is very, very critical to making young minds recognize their talents and skills, and also potentially identifying potential career choices for them. I think another aspect of the film, and they brought it up, and I say that all the time, is if you can't see it, you won't aspire to be it. So seeing individuals that are from places that you come from, that speak the way you do, that look the way you do, again, you know, makes you feel a little more confident if you aspire to become a physician.
Yeah, so what do you think that the both of you had that Black men are not getting right now to become you in the future?
Well, as I said earlier, I think I was extremely fortunate to have parents that were very, very encouraging and actually pushing of, you know, expanding and exploring your academic success. I was a very good athlete, which was great, but my mother said, you know, what if you don't make it to the pros? You know, what are you going to do next? So she was very much, you know, pushing me in spaces that utilize those talents. I think another thing that she did was making me step out of my comfort zone. You know, I remember she sent me to a public speaking program at St. John's that was free. And she said, you never know when you might need to speak in front of people. And I think a doctor will need to do that. And I said, Ma, what are you talking about? But again, not recognizing her vision and wisdom, and I appreciate that.
Yeah, your mom pushed you. Dr. Farquharson, how about you?
So I think it really boils down to exposure, and that's one of the things that the film highlights significantly. Growing up, you know, people always ask you the question, you know, what do you want to be when you grow up? And I always knew I wanted to help people. So that was anything from being a police officer to an educator. And it wasn't until I got to undergrad where I met my first Black male psychologist that kind of showed me and took me under his wing. So I think it's about that exposure. And I really hope that we can start asking, instead of what do you want to be when you grow up, let's start asking young Black people what problems they want to solve, because that opens up so many doors, right? Because we're not just asking, do you want to help people? Do you want to cure hunger? Do you want to make people healthier? People can be interested in science and just not know that they have opportunities in medicine, right? So if we start asking a different question, then it opens up more doors, and because we only can do what we're exposed to.
Wow, I love that. What problem do you want to solve? It changes the whole conversation. So talk about the conversations you all had with the high school students that you watched this documentary with. How did they receive it?
That was certainly a joy. So we made it to two schools local to Long Island, Brentwood West Middle School and Longwood High School. And it was such a joy to see young kids of color come together and really just have open hearts and open minds to a new experience. Obviously, they're starting to have conversations with their families and their educators about what their next steps will be. And they had such thought-provoking questions. They took the film very seriously. They were attentive, and I was just overall very impressed with them. And you could tell that the educators are doing a phenomenal job. They asked really critical questions. What did we have to overcome? What were some of the things that helped us? What resources were available to us? What family members and community stakeholders help us get to where we are? And so clearly they're trying to chart their path ahead of time, and it's really exciting to see.
Yeah, Dr. Phillips, what did you have to overcome? What did you tell them?
Well, again, in my community, I didn't have the image of doctors, so that wasn't something that was right for me available. I did not have people in my family that went away to college. So again, those types of images, as Dr. Farquharson said, they were lacking in my community. But, again, when you're the oldest of 6 children, as I was, and you come from a West Indian family in part, you are pushed in ways and cannot, resist the push. So, I appreciate the push that allowed me to overcome those deficiencies. But one of the things that I also thought was great for me was my mother would always send me articles about Black men in medicine. There was a Dr. Gerald Dees that used to write for the Amsterdam News, which was a written publication when I was younger, and he would do a health column. And she would send me copies of that. Just giving me an example, I remember reading the autobiography of Benjamin Carson and how impactful that was, just seeing some of the things and challenges that he had that were very similar to some of the challenges that I had myself. So not seeing the destination can be very challenging, but I think, again, as Dr. Farquharson says, the things that we can do is try to provide some visual opportunities so that children can see that they can become what they aspire within the healthcare field, hopefully doctors as well.
So for people who want to see this documentary, what should they expect and what's really at stake here?
Well, I think what they're going to see, go ahead, I'm sorry, Will.
No, so I was just going to say, I think you'll see not just the exposure, but you'll hear about the stories that people can sink their teeth into, the stories that we connect to as members of the Black community. And I think you'll definitely get some inspiration. And what I also appreciated was the education. A lot about medicine is kind of in the air. People don't know about it unless you have family members having conversations. So discussions about what residency is and post-baccalaureate programs, those discussions are happening in the film, as well as some of the ideas of what pipeline programming should really be about. So starting from younger ages, kindergarten, there's people that are in kindergarten wearing white coats and having fun and activities with science, those types of things, really reaching back and showing the importance of that, and then really insulating these pipeline programs so that people are well taken care of until they reach, as Dr. Phillips said, their final destination in medicine.
Yeah, well, thank you so much. We're running out of time. Dr. Phillips, I just want to say it's really expensive to go to medical school, though. What do you tell people who say it's just too expensive and that way it's out of reach?
Well, there are other opportunities. We have scholarships. For example, at Stony Brook, we have a scholarship named after one of our famous retired administrators, Dr. Aldustus Jordan, which is specifically geared towards giving financial support to underrepresented minority groups. I would really encourage you, you got to really be, as they say, you got to hustle. And I think, again, with the technology we have, that research can be a lot easier than it was when I was younger, when we didn't have the phones and other portable devices to use. So scholarships are available. As Dr. Farquharson said, you know, pipeline programs are available so that you can get yourself in the same space. But I think, you know, finding out about these opportunities are very, very important.
Fantastic. Thank you so much, Dr. Jedan Phillips and Dr. Wilfred Farquharson. Thank you so much for joining us. And for more information on the documentary, go to our website, that's cbsnewyork.com.